Hello everybody and welcome back to my channel. For those of you who don't know me, my name is Beck. I'm a registered nurse from Western Australia, and yesterday actually was my last official day of my grad program. For those of you who don't know what a grad program is yet and are just, I don't know, starting out there on the nursing journey and seeing what it's all about and getting insight, you finish your university degree and then you do a year grad program. And the grad program basically gets you into the hospital. You can do grad programs in aged care or the hospital, pretty much in different specialities, and that gives you your year experience in the hospital so you can go working at other hospitals. You can still get a job without having a grad program under your belt in the hospital. There's just a few more hoops to get in, and you're less supported when you go into the hospital because it is a bit of a daunting setting. So yeah, I've just finished mine, and this video is going to be all about my tips for new grads, because if you are watching this video, you most likely just graduated and are heading into the hospital or heading into the workforce as a new nurse, and that is very, very exciting but also very, very nerve-wracking. I remember on my graduation day some of the girls had already started working as a nurse, and I was just looking at them like, oh my gosh, like how do they do it? Like, isn't that terrifying? Like, are they a changed person now? Like, they've been in the hospital as a nurse. Like it was like this massive thing for me, and then I started, and yeah, now I'm finished. Now I'm about to go on maternity leave. I've done a video on tips for new grads, like getting a job and like the options and stuff like that, so I'll link that up here. So if you're not going into a hospital setting, this video can still apply to you for sure, but probably maybe not as relevant, but still relevant. Anyway, let's get into my tips. So if you see me looking down, I'm reading off my laptop because I've written out like a massive list of tips. First things first, I want to explain to you that you are not alone if you feel completely overwhelmed and completely lost in your first few months, your first day, your first everything. Like, you are not alone, and every single person before you has had a first day and they know exactly how you're feeling. So don't feel like you have to hide the fact that you're overwhelmed or that you're stressed or that you feel like you don't know what you're doing or you feel out of your depths, because every single person has been there. My first day, oh my gosh, I was so nervous. Like, we had a week of orientation, and then the first day in, you get a supernumerary shift. So that is one other thing that you should remember, is you are not expected to go into the hospital, go into the ward and magically know where everything is, know the certain procedures of that ward, know what that ward normally does, etc, etc. You have 1 or 2 days where you're buddied with another nurse, and they will show you the ropes of that ward. They'll give you an orientation, show you all the rooms where everything's kept, and you'll get a general idea of what to do and what to expect, like the routine of that ward, because every ward pretty much has a different routine and how they go about their day. On my first day, I think it was my first supernumerary shift, I basically walked in and the nurse I was with was like, oh yes, awesome, I've got a grad nurse. So it meant that we didn't have to find checkers or a buddy for the whole day. So she was stoked because it meant that her day went well, because instead of wandering around the ward looking for someone to check your DDs with you or do a turn or do a 2-assist patient or checking your IV antibiotics, like, she had someone with her the whole day, aka me, aka super nervous, overwhelmed, excited Beck with her to do all the checks with her. We went to do IV antibiotics, and she was like, oh, you do them, and I'll just sign it for you and check it for you and just show you where the machines are and stuff. And I hadn't done IV antibiotics in just under 2 years, so I was absolutely freaking out because I could not do an IV antibiotic quickly. And the ward that I was on, everyone is on IV antibiotics, everyone. So your day starts with meds, obs, IV antibiotics, DDs, and it's just insane. So I was literally shaking as I was trying to draw it up the vial and then put it into the bag, and I was doing everything wrong, and I was just I felt so embarrassed because I could only imagine what she was thinking, being like, oh crap, here we go, here's a grad that has no idea what she's doing. But I just asked her for help. I clarified every single step I was doing with her, and I got through it. And the next day I did all my IV antibiotics on my own and I didn't have any issues with them. So don't be afraid and feel like you're the only one that's overwhelmed or feeling lost or just in general freaking the heck out, because you're not. Everyone's been there, and most nurses and most people on the ward around you will understand that. Just touching quickly on the supernumerary shift, so you should get 2 of those and utilize those shifts like mad, because there are your shifts that you get to learn the ins and outs, you get to learn everything to do with that ward, and you get to ask all the questions, because you generally should have a pretty cruisy day with 2 nurses, because you're technically not there for that shift. Like, you're not on the numbers, you're not expected to have your own patient load. You are just buddied with this other nurse and you both are one. So ask all the questions, use that day to your advantage. Another one is to keep on top of your grad workbook. When you start, you should get like a bucket load of paperwork, a bucket load of competencies, like you have a pretty much most grad programs, I'm sure, will have some sort of like curriculum and like a workbook that you have to work through and get signed off on things. And don't be like me and leave that to the last minute, where you have to like run around the ward like a crazy lady on your last shift as a grad, getting everyone to sign your book and sign you off in all the competencies, because you didn't do it throughout your year. You had to get it done. Get it done early, just cruise with it, bring your book to your shifts, put it in your locker or put it somewhere at work, and then if you do a skill that you know you need to get signed off on, just be like, oh hey, do you quickly mind signing me off on this skill? Like, it's annoying, but it'll save you so much time and stress in the long run. Is get a little notebook or a little drug book. My manager actually recommended to me that she got a to Z address book and would use her drugs, like would write down drugs she didn't know in that address book. So it already was alphabetized for her, and all she did was be like, okay, metoprolol, what's that? And she would write it down and she'd go look it up and write in what it was. Even that process will just tick in your brain and you'll know so many drugs so quickly. I found at the start that was really helpful for me. Like, I would write drugs in a book and I would write like terminology in a book, and then on my breaks or when I finished work for the day and I went home, I would look everything up and write it down, and that just helped solidify all the information from uni and all the information from your first few weeks. And it was a great resource to have if you're in handover, and on the handover sheet there's like a bunch of terminology that you don't know. Just sit there and highlight it, and then during your break write it in your book, and then when you go home research them. Just a quick Google search will tell you, and you'd be surprised at the knowledge that you would pick up just from that. There's still things on handover sheets that I don't know what the heck they mean, and that I have to do the same thing. Okay, so this tip is a pretty standard one, but I wanted to cover it just because it's very, very important. Number 1 is don't be afraid to ask for help, and number 2 is don't be afraid to ask questions. Honestly, the amount of questions that I asked in my first like probably 4 or 5 months is insane. I feel like if any of the nurses that I worked with on those first few months watch this video, they will know what I'm talking about, because it is atrocious the amount of questions I asked, but absolutely necessary. I do not regret asking all those questions at all, because it saved me from putting my patients in danger, it saved me from not understanding a procedure or something I'm doing, and the amount of times that the questions I asked were relevant completely outdid the times when I asked questions that weren't relevant or that were silly questions. As a nurse now on the ward, and if I have students or if I have grads come up to me asking me for help or asking me questions, I 100% explain everything, and I'm 100% happy to. If you're really struggling and you don't feel like you can ask the nurses on the ward for help and stuff like that, always go to your manager or go to your grad coordinator. They can provide you with extra resources, extra training, extra learning, and that can help you. The whole point of your grad program that you're doing is to support you in your first year of nursing on the hospital. The whole reason it's there is because your first year of nursing is terrifying and hard. Like, very hard. Don't feel like you're failing by asking for help, because that's the whole reason you're doing a grad program, and that's the whole reason you have the support there, like a grad coordinator and your manager. And don't be afraid of failing either. Like, I remember one time I was so slammed and I hadn't prepped a patient properly for theatre. I would do my med round and my obs and my other patients first, and then go to this patient, and then I would leave it until I thought, oh, it's time for them to get ready for theatre. And I got caught out once really, really badly, to the point where my manager had to help me get them ready because no one else could. And it was just an absolute show and a half. Like, they got to theatre, thankfully, but it was embarrassing and it wasn't a good scene. So, I mean, it happened to me, I dealt with it, I was embarrassed, cool, I got over it, and I learned from it 100%. And that's the whole point of being a grad, and that's the whole point of learning and becoming a new nurse, is accepting the fact that sometimes things are gonna go wrong, you're not gonna know everything, you're gonna get things wrong, and you've just got to accept it and be like, cool, I've learnt from this, and as long as you learn from it, it doesn't matter. Like, after that, I prepped my theatre cases so early. Another thing is, kind of goes along with asking for help to asking questions, is double check absolutely everything. Before I gave anything that I wasn't sure of, if I didn't have time to look it up myself, I would quickly ask someone. And the amount of times that I saved myself from making like an error of some sort is insane. I double checked if I thought a patient was deteriorating, I double checked whether I was supposed to do something right. Like, I must have been the most annoying human to start on a ward ever, and I am totally okay with that, because in the long run it has helped me so much, and I know that my colleagues around me trust me as a nurse, and I know that they are happy to work alongside of me, if that makes sense. Like, I would rather be annoying at the start so they know that I'm wanting to learn and wanting to get amongst it, and unsure of things, and be 100% okay with looking like a dick, because in the long run it helps you out a lot. I remember my first day, this is more like reminiscing on my grad year, but my first day, I think it took me 2 hours to do my med round. It was my first day on my own, and I literally remember sitting in the patient's room, having the keys, being on my own, about to administer medications, and I was like, no one's here to double check what I'm giving. No one is over my back watching me. No one is supporting me. This is me, and it's on me if I stuff this up or if I give them the wrong med. And it was like a big ton of bricks crashing in on me. I was like, oh my goodness. And it's okay to feel like that, because everyone feels like that. The first time you give a medication, even if it's Panadol, you're like, oh, and you want to double check everything. And it took me 2 hours to do my med round. It was absolutely insane, because I did not know many of the meds at all. So I would like take my chart into the drug room, go over all the medications, and quickly look them up, the ones that I didn't know. And that took me so long because I was so paranoid. So I would definitely recommend doing a little bit of research on the ward you're on and some common medications on the particular ward. Like, you will find that a lot of the medications are very much the same. I was starting on a surgical ward, and pretty much it was painkillers, anti-inflammatories, anticoagulants. Definitely recommend trying to do a little bit of study before you start, because I did not, and I regret that for sure. I know this is kind of unrelated, but if you're starting on a med surg floor, I'm doing like a little series on my Instagram called Medication Mondays, and I go over regular medications that are given on medical surgical floors in Australia, at least. And I think that would have been so helpful for me, because the medications, most of the medications that I'm going to put up, I didn't know what they were before starting. Next is read your charts and paperwork. 90% of the time, you're charting and what you're writing like your obs into, your blood sugars into, they will tell you what to do on the back side or the front side if a observation is out of the normal limits. So make sure you read things before you ask things. Like, that's one way to avoid asking too many annoying questions, is if it's right in front of you. We're playing this game of Monopoly Deal. This is completely irrelevant, but it kind of gives you a good example. And we have taught so many people how to play it, because it's like a really easy card game to play. I always know this because the cards on the card pack as you're playing, all of the cards explain what they do. I always say to them when I'm teaching them how to play is read the cards as you're playing. Like, it's easy to sit back and read the card and be like, okay, so that's what that card does. and everything flows so much easier. And it's the same with nursing. I know that's such a random way to explain a nursing thing, but it's just what's going on with me. Like your obs chart, if you put anything like that, even coloured. So if you would have learnt this in nursing school, so you will know this, but if something's like in the purple zone, it's like a met call. If something's in the like orangey, yellowy, I don't know what colour it is, but it's colour coded. So if you put your observation in that colour, turn it over, read the back, it'll tell you exactly what you need to do. Same with blood sugar levels. If you are charting a blood sugar level and it's too high or too low, it'll be in the coloured zone. So read it over and read exactly what you're supposed to do, because it'll save you in the long run so much. And if you have a day off and you're really struggling, and you're like struggling with like certain procedures and stuff like that, your hospital will have a policy for everything. Like your hospital have a policy for putting catheters in, starting up IV infusions, like, and that tells you exactly what you need to do. So if you're needing to do something new, like I remember I had something, I can't remember specifically what it was, and I asked one of the nurses and she was like, oh, there's actually a policy for that, and it highlights everything that you have to do. And she went and printed it out for me, and that was something that I learned early on. And then if I ever felt like I didn't know how to do something and I didn't feel like asking all the time, I went and printed it off, looked it up, and then it would be like an instruction manual for how to do certain things. So know that that's there. On your days of orientation, ask your grad coordinator, ask your buddy, how do you find the policies, because as much as we joke about them, they are very helpful to have, and they will help you in the long run for sure. Like once you've stopped drowning, because you will drown at the start, everyone drowns at the start, make sure you try to be as helpful for other people as possible. If you are up to date with your meds, up to date with your obs, and you see someone else drowning, go ask them if they need help. Like help out as much as possible, because that'll help you in the long run as well, because they'll know that you are helpful. They will be happy answering your questions and helping you when you're lost or struggling, because they know that you're going to help them. And if you're helping them do something that you're not sure, like a complex wound, like the amount of times that I learnt wound care and advanced wound care things off of another nurse just by going and helping them do it, like holding the leg for them or gathering supplies, you will learn a lot more. And it's just helpful in the long run for everyone. Like the ward is a team place, the whole hospital acts as a big team, and you need to be an effective part of that team. So yeah, help. Tips for like starting off, like before your first day, is make sure you're organized like a few weeks ahead before your start date. Sometimes your uniform won't come in early enough and you'll have to wear your own scrubs. A lot of people that I started with didn't have their own scrubs of the color of the hospital, so they were running around trying to organize scrubs and everything, and it was stressful for them. And it doesn't need to be stressful. Before you start your first few days and all of that, you'll know what color scrubs the ward wears from your interview or from just knowing the hospital. If you don't, go into the hospital, pretend you're a visitor, look at the nurses, see what color scrubs they're wearing. Go out and buy yourself a pair of scrubs in that color, just in case your uniform hasn't come in and you're not stressed out trying to figure out something else to wear, like me. Learn from my mistakes. Get all your paperwork ready early. On your first day, you'll probably need to bring like working with children's check, your degree, your member number, like all of the random stuff that you've just got lying around the house somewhere random, unless you're really organized. But get that all prepared and ready and packed it up early, and just have everything ready, because that can help alleviate a lot of the anxiety towards your first day. I feel like I've already talked for so long and I've only got a few more tips left, so please bear with me. I hope this is helpful. Let's talk about code blues. And codes, just any sort of code and any sort of like experience that you're really anxious about. I remember my biggest thing that I was nervous for was my first code, and if I had to code my patient. It terrified me, because as a student I'd only been a part of like 1 or 2 codes, and I remember just being like, I'm not gonna know what to do. And I remember my first code, it wasn't my patient, but I was on shift and obviously attended the code, and I just stood in as a runner. Like, I just kind of observed what was going on, listened into the conversation that was going on, listened to the doctors who came up, listened to the handover the nurse gave the doctor as they came in, all of that. And I just stood outside the room and was a runner. So they needed a shaver so they could get ECG dots on. And so someone yelled out, can someone go get a shaver? And I just was like, yep, cool, I'll be the runner, I'll go get a shaver. Ran back, we need this, cool. I went and like, so I was just that person, and I learned so much from that little experience that I was less scared and less scared and less scared of codes further on. And even if you're just standing there in the code and you're not necessarily needed, like a lot of the times you'll have soft codes where it's just because they fall into that parameter, but they're asymptomatic. You just need a doctor there to either put some mods in or just to start some IV fluids because they don't have a cannula or something like that. And they're pretty standard codes, and you'll get the hang of it. And if you just stand in the corner and watch, nobody is going to judge you. Like, I did that a few times, and I would just do random things, and it was very helpful because I learnt so much. And I think that's how I can be a lot more chilled and know exactly what to do in a code now. If it's your patient that's coding, that's kind of like a whole new story. I remember the first time I had to code my patient, I was a mess. I didn't want to talk to the doctor, I didn't want to hand over the patient, and that's fine. Like, nowadays I still get anxious if I'm coding my patient and I have to explain what's going on and the history in the background. Like, I still get scared. But in the early days, your coordinators and your nursing staff that are around you know that you're a young nurse. They know that you've just started. They're not going to expect all these massive things of you, and a lot of the times the coordinators will handle the handover of the patient anyway. You're gonna have days where things suck, and you're gonna have days when you don't know stuff, and you're gonna have people yell at you, and you're gonna have things, and you will build resilience so fast. Before starting as a nurse, I was so scared and worried and want to say the wrong things to the doctors or the nurses, and nowadays I fully advocate for my patients. You will get this confidence and you'll be like, what just happened? Another thing quickly is, don't feel like you can't achieve more than what your grad program is offering you. When I first started, I basically got told, no, don't do cannulation. And now there's 2 nurses out of the grad program that have done their cannulation in their grad year, and they are so much further ahead because they've thrown themselves into extra learning opportunities. One of them's done their advanced life support, done extra like aggression training, and everything just adds up. It just didn't cross my mind until a few months ago. It was a massive realization to me to be like, you don't have to stick inside your grad box. You can do added learning opportunities. If things that come up on the ward that you're passionate about, like advanced life support or advanced wound care, jump on board them and get involved, and don't feel like you can't because you're a grad. My last but not least little tip, or my little experience for you, is don't be afraid of doctors. They are not all as scary as they seem or intimidating as they seem. I remember as a student and as like an early grad, oh my gosh, I was so scared of them, and I didn't want to talk to them. I didn't want to ask them anything from my patients. I found in the early days, listening in, if I was at the nurse's station and I was doing charting or something, and another one of my colleagues was chatting to a doctor asking for things, I've always got like an ear out to be like, okay, how are they asking for that? Why are they asking for that? What's the doctor's response like? And that helped teach me how to communicate with doctors and how to ask what I wanted, because at the start I really had no idea. I would just freak out, especially calling them. Oh my gosh, it was so scary. But really, they're just another human being. They've started their first day before as well. They know what it's like to have no idea what they're doing. We have like doctors lists, so because there's so many different teams, we have lists and we add our jobs to the list. And if it's a job that doesn't need doing right then and there, I will add it to the list and completely leave it alone. Or if it's something that I need it by a certain time, I will go find the doctor, or if I see them on the ward, I will just quickly grab them and be like, can you just quickly do this? I'll get everything ready for them. Like if it's recharting meds that are due at 8 o'clock at night, I'll get the charts in the file, sticker them, then go to the doctor and say, I need this charted, I need this recharted, I've already put the med charts in there, I've already stickered it, can you please just do it so I can give my 8 o'clock meds? And most of the time they'll be very thankful for that. I hope that helps. I got a little bit stuck on a tangent and it's going to take me a long time to edit this video. I really hope that you enjoyed all these tips. You're not alone and you're going to make it through your grad year and you're going to be so excited and you're going to get paid for the work you're doing, which is the biggest bonus of all. You're going to make a great nurse and yeah, enjoy it. Enjoy the experience because it can be a very positive one. Thank you so much for watching this video. Feel free to check out my other ones. Okay, bye!